Thank you very much, Emily, and welcome to all that are watching or will be watching this. I'm Ludovico. I'm at King's College London. I'm going to guide you through a work in progress that I'm doing together with Vahe Nafigian and Mauricio Avendano at King's College. What is the topic of this work? Let me give you some context. We're going to look at very broadly at the issues relating to intergenerational exchanges, intergenerational support. We know that intergenerational exchanges are increasingly important for our society. In particular, this paper will focus on intergenerational exchange of time, and in particular of care support, for example, from an adult child to an older parent, or from adult children to grandchildren. There are also other types of support. The aging process is impacting this context through some transformations. The aging process leads to, on average, an increased need of care in the population. There will be more people in need of care due to the aging process. So an increase in the demand of care by older people. The aging process also triggered numerous policy changes, for example, pension policy changes aimed at prolonging working lives with, in order to meet, let's say, the doubts and the concerns over the sustainability of the pension policies, of the pension systems. Also, aging process led to care policies that have reduced the budgets for formal care and have instead pushed, let's say, the responsibility towards families. How are these changes interacting, and in particular, how is the changes in pension policies affecting the care? So our research question is, how does prolonged working lives, especially in the UK, affect intergenerational support of long-term care to vulnerable older people? We will take the caregiver's perspective. So how does prolonged working in older age affect the supply of informal care, but also a societal perspective looking at the point of view of the care user. I will go back to this in a few slides. So in theoretical terms, the economic literature predicts that prolonged working would reduce informal care because there would be some change in the opportunity cost of time when people continue to work instead of retiring, for example. But we know that there are many complications, many additional angles that we need to consider. The role of job type, what type of job people do, and they have to do for longer in time. Heavier jobs make it harder for people to balance work and care. What is the role of the type of care that is given? Is it care given extra household for parents? Is it care given in household for a partner? We know this embed very different also emotional involvement. What the degree of altruism of the caregiver, the social norms that may make feel like an obligation, the care provision to a caregiver. And also multi-generational care responsibilities. In the previous slide, I gave the example of someone that has to care for parents and for children. These people may be affected differently by the prolonged working. We have limited evidence on the effect of longer working on care, with two very recent studies providing some evidence for Europe, but not for the UK. So the caregiver's perspective. We use data from Understanding Society. We focus on a group that is particularly important in care provision, which is a group of women aged between 55 and 65 between 2009 and 2017. In the sample, and within this sample, 8% provide some care in household, 20% provide care extra household. The amount of hours is very different depending on whether care is provided in household, more intensive, or extra household, less intensive, but more people. And there is a general negative correlation between care hours and work hours. So a correlation that says the more you work, the less you provide care. How do we test this relationship between working and caregiving? In principle, we would use a two-part model. So we would first try to explain the decision to provide any care. So probability to provide daily care is explained by the working hours and some crucial controls, apart from socioeconomic status and other controls. We need to take into account the age of people. So we, in this model, will account for it with dummies for each level of age and for the time that passes. So a dummy for each level, for each year. And then the second part of the model would instead explain the amount of care that people give in terms of hours of care, only among those that provide some care. And in Understanding Society, we have this information. The problem is we cannot just run this model because we are concerned that the decision to work and the decision to provide care are endogenous one to the other. We need an exogenous incentive to work that we believe it's not related to care. And we use it, a pension reform, as I said at the beginning, and we use it for the UK. There has been an important pension reform that has postponed the state pension age of women. So we, looking in within our own Understanding Society survey, we can observe in a very close distance women of same age, but because of the change in the legislation, some are above the state pension age and some are below the state pension age, while being, for example, 60. And if you compare these two groups of women, same age but different eligibility, the group that is below the state pension age is more likely to work or is more likely to work more hours. So we would exploit this as what we call an instrumental variable. So we will explain, we will basically estimate the effect of caregiving on caregiving of working longer because of people have a higher state pension age. So we will only consider women who have ever engaged in paid work that have been affected, therefore, by the change in the legislation. We go in the paper very longly in the discussion of whether this instrument is valid. It should correlate, state pension age should correlate with attachment to labor market. We know that it does. It should be as good as randomly assigned. The reform affected people depending on their birth date. It should also affect care only through employment. This is a crucial assumption. We test very severely for this assumption by including heavy controls for age and for time and other strategies. So we are confident that we are able to say something causal on the impact of work on care. What are the results of this analysis? Our instrumental variable approach says that we cannot say anything on the probability of providing care. Working longer, we cannot say it reduces the probability of providing care, but we can say that working longer reduces the intensity of care that people give. And an increase of 10% in work hours, we estimate leads to 3.7 probability points, not percentage, lower care, 3.7% reduction in care hours. If we want to get an economic sense to this, suppose that work goes up by 10 hours because of the pension reform. This would reduce care by 2.1 hours per week. We are talking about hours per week. If we predict this, that this would be constant during the year, this would basically amount to more than 100 hours foregone during the year. If you use the usual simple, let's say, but important estimate of how to evaluate this amount, you would get a monetary amount of £2,000. We also estimate that working longer reduces the probability of providing meaningful care, 5 or more hours, and also intensive care, 20 or more hours of care per week. Only on extra household care. We don't find result for in-household care settings. What type of care is reduced? Well, all sorts of care. We can see from this graph that the probability of providing help with instrumental activities and also with the crucial core activities of daily living is reduced by working longer. Also, we look at some of the questions I posed at the beginning. Does the type of job matter? So using an external measure of job demand, basically the intensity of the job, how heavy is the job that people need to do, we are able to show that only those women that are involved in heavy jobs actually show a reduction in care intensity, and the reduction is higher than the average amount that we would estimate on the overall sample. Also, we look at multi-generational care responsibilities. We cannot use the information on whether people have living grandchildren or are providing grandparental care let's say, but we use information on whether people have living parents and living grandchildren. And we find that only among the group that have both living parents and living grandchildren, the effect is important. Interestingly, this sandwich population reacts more to the extending working, let's say, than the population that doesn't have grandchildren but has parents. So sandwich are more affected by this, even more than those that have living parents but no grandchildren. We estimate that there is no significant household effect, so the partner of these women that work longer do not react to these changes, and our results are robust, controlling for caregivers' health and caregivers' income. We also ran several placebo tests and other technical but important checks that confirm our results. But let me give you just briefly the second perspective, the societal perspective. So suppose that we can observe a household, and we observe a household where there is a parent and there are children in two times, at 2 points in time. So in the first period and in the second period, the parent is always above the state pension age, is an older parent, okay? But in one period, his children are all below the state pension age, but in the second period, one of these children, the one daughter, actually switches to be, and she is above the state pension age. Now, why this is interesting? Because the pension reform in the UK postponed this, basically, no? Because it increased the state pension age. So we are asking, what effect did this have on the care, overall care received by the parent? Did someone step in, for example, to compensate the lower care provided by the daughters? In order to answer this, we use another data set, the ELSA English Longitudinal Study of Aging database. Basically, we look at quite a simple model that has as dependent variable for the parents having received any help and how many tasks this parent receives help with from any provider, daughters, son, formal providers. And the variable of interest is whether this person has all the daughters below the state pension age or not. And we run an individual fixed effect model, so we estimate the effect of having a switch in this variable. So what happens when one daughter, the eldest daughter, becomes eligible for pension? What is the result? Let me read it on the other way around. So what is the effect of having all the daughters below the state pension age? Something that the reform prolonged as a situation because it postponed the state pension age of daughters. Well, having all the daughters non-eligible to receive the pension reduces the overall amount of help that the older person receives from any provider. We can go a little bit deeper and look at several providers. So we can look at what is the effect from daughters, and we find that, unsurprisingly, when all the daughters are below the state pension age, they provide less care. This confirms our other work. But we also estimate what is the impact on the care received from other informal carers and from other paid providers. We find that there is no reaction. So the lower amount of care from daughters is not compensated by other sources of care. So I'm going very, very quickly, but to sum up, we are getting some evidence that working longer will lead to large reduction in caregiving, especially on the actually only on the extra household setting. This is linked to the type of job that people have and to their multi-generational care responsibilities context. And overall, from the other point of view, we can estimate that this can be concerning from a societal perspective because we estimate that so far it has led to a lower overall amount of care that is received by older people, with potential effect on unmet needs, on quality of life, of course. This leads to several potential policy implications, like incentives to employers to give flexibility and part-time options to people that face a longer working horizon, for example, because of the change in the pension rules. Of course, this highlights the need for more formal care services, which is a very important issue also in the UK, given the problem with the budget. And it may also raise the importance of having a support for caregivers for example, through a caregiver allowance that can perhaps allow some caregivers more choice in terms of this work-family conflict. I think I'm on time, and I'm gonna stop here. Thank you.